Welcome everyone to another episode here at Joss Podiatry. Young gentleman recently presented to our office. Chief complaint, bilateral, left and right great toenail. Let's come around, let's show everyone here. Discoloration, probable fungus. You know, he's been battling this for about 10 years, and it gets to a point where, you know, in my experience, aside from the fact that he's had a lot of nail trauma as a result of playing a lot of tennis, trauma will create definitely a lot of this, okay? But there's obviously a lot of subungual debris, all of this debris, discoloration, and sometimes even with all of the treatments that we have and all the tools in the toolbox, it's simply not enough. It's not enough to eradicate the problem. These are the cases where in young, patients in their 20s and maybe 30s as well, I will recommend that we remove the nail in its entirety, okay, and just start fresh. Because, even if we leave this is all hollow, and they're here in Miami, as in other places, a lot of moisture collection. And it's just gonna make things not necessarily worse, but it's not gonna get any better. So the first thing I ask patients, are your nails growing? If they say yes, fantastic. If they say no, that's a problem, because we are only able to notice the results if the nail grows. Okay, so what we're gonna do, just to recap, we're gonna remove both toenails. We're gonna put them on a pulse dose course of oral terbinafine, oral Lamisil, which is a phenomenal medication. We're gonna, once the new nail starts to grow out, we'll implement the topical antifungal regimen. Then we'll eventually possibly consider the laser, and we're gonna hit it with the entire full Monty whole enchilada. Let's move forward. If you feel any discomfort or anything, just please let me know, please. Okay, bud? Okay. We're just loosening up the back here. Okay. The problem with removing these, especially this one that's really, really attached, it's adapted completely and totally. This is the back there. Got a nice little close up there, Elizabeth. Mm-hmm. This is what I mean. All of this, the nail adapts. So what we'll do now is just kind of you gotta remove this. Very, very important, because if not, this little, that will basically just create more long-term issues. Okay. Número dos, number 2. Basically just release. Releasing all the attachments back here.
kind of like that. Nice and easy. Just like that. Again, there's a lot of adaptation here. The nail, just like the other one, very slowly. We don't want to injure the nail bed. And I'm not pushing hard at all, I'm just really slow. Sometimes you can't really avoid just like that. This is actually the key to the procedure. Okay. Same thing here. So everyone can see it's still attached here distally, sort of expected. Go ahead and do is just trim this here, just like that. Nice and clean. Okay. Show that to the public there. The red, all this, that's called blood. It's a joke. Okay, everyone. Procedure's done. We're gonna go ahead now and wrap everything up. Just a quick recap. Today we performed bilateral, left and right great toe. Total nail avulsions. We removed the entire nail plate. We're gonna wait just a couple of days, and we're gonna start the pulse dose of the oral terbinafine, also known as Lamisil. www.jawspodiatry.com, Instagram, Dr. Toe Jam, Jaws Podiatry, Facebook, and last but not least, our YouTube channel, Jaws Healthcare. 1 second. Do you have any other questions? Any questions? Any questions? You guys can ask. The camera's not going to move that way. Questions? We're good? If anyone is wondering, what now? The patient's going to have a bandage afterwards. Maybe tomorrow he will remove the bandages, and then he's going to start some soaks. And the post-procedural protocol is very, very simple. Remember, we did not cut the skin. People think that when we do these procedures that we cut the skin. The only thing we did today, and when we do the ingrown toenails, right, is just remove the nail. That's all we're doing. So the recovery is very, very quick. I've, a little bit of Tylenol for, the discomfort, if any, and that's about it. No narcotics, nothing of that nature, right? So the recovery is very, very quick. I've had patients ask me, can I go back to the gym, to this? 100%. Maybe a little sensitive in his case because there's no nail, right? Our nail is a barrier. It protects. But after a couple of days, that hypersensitivity is going to just poof, go away.